Hello, and welcome to my poster presentation for my Capstone experience. I will be speaking to you today about understanding the role of aquatic occupational therapy for a variety of diagnoses in pediatric outpatient rehabilitation. This experience was completed at Nationwide Children's Hospital under the advisement of my mentor, Emily White. Emily is the occupational therapist that provides aquatic OT services at Nationwide Children's Hospital and was a wealth of knowledge about this topic, as well as general pediatric occupational therapy information. I also completed a portion of my capstone experience through The Ohio State University under Dr. Erica Kemp, who has specialized skills in aquatic occupational therapy for a pediatric population. To initially gain information and better understand the current available research pertaining to my topic, I completed a systematic review looking specifically at children with autism spectrum disorder and how therapeutic aquatic intervention can impact these children's ability to gain swim skills. With an initial search further into autism specifically, it was found that 1 in 54 children are diagnosed with autism spectrum disorder, or ASD, and that drowning is a leading cause of accidental death for children under the age of 14 with this diagnosis. Additionally, the symptoms of ASD can cause difficulty with learning novel tasks, such as swimming. However, swimming is documented as a preferred activity by children with ASD and their families. To learn more, I created the research question. For children with ASD, does therapeutic aquatic intervention increase swim skills? To gather relevant research articles, I completed a systematic review through the Preferred Reporting Items for Systematic Review Process, or PRISMA process. For the included 9 articles, I completed critical appraisals to determine the validity, reliability, and applicability of the article. I also completed a Cochrane bias assessment and determined the grade recommendation of the articles. The results of the systematic review showed that there was moderate quality evidence with a weak plus strength recommendation, resulting in a yellow traffic light adaptation. This demonstrated that there were increases in swim skills with no adverse results. Therefore, it is appropriate to continue with this type of intervention, however, ensuring to continually track results and encourage future research on this topic in order to determine best practices for increasing swim skills for children with ASD. The common approaches in the interventions within the 9 articles included in the systematic review were the individualized or small group interventions that were provided, and the interventions being led by a therapeutic or educational professional that had knowledge about the diagnosis of ASD and understood what aspects of the intervention need to be considered in order to facilitate growth for the participants. Specialized instructional methods throughout the articles included a focus on motor learning aspects, initial focus on core strengthening and stability, the use of visual schedules, the use of task analysis, and use of multimodal cues in order to encourage skill acquisition. Here you can see the strength of evidence table, which shows each article as it was assessed for risk of bias, and then how each article was grouped together in order to determine its effects on swim skills. As mentioned from the results of the analysis, therapeutic aquatic intervention can increase swim skills for children with ASD, though the intervention should be used with caution and continually documenting the results. Ultimately, this encourages additional research in order to determine the best practice guidelines in this area. With all of this information gathered, I set off on my capstone experience at Nationwide Children's Hospital. Nationwide Children's Hospital, or NCH, is among the largest pediatric hospitals and research institutes in the United States. Therefore, they serve the Central Ohio community, the national community, and even the global community by providing acute, inpatient, and outpatient services for the pediatric population. Outpatient occupational therapy services are provided to patients with a variety of diagnoses by 38 occupational therapists and 2 certified occupational therapy assistants, or COTAs. Comparatively, aquatic occupational therapy services at NCH are provided by only 1 occupational therapist for just 4 hours per week. The current program focuses mainly on treating musculoskeletal conditions in the aquatic environment. Therefore, to increase knowledge about and develop the necessary structures to increase the utilization and efficacy of the aquatic occupational therapy program at NCH, my role was as follows: to develop a structured referral process to support proper referrals for aquatic occupational therapy, to create staff and parent education materials to increase knowledge about the benefits of aquatic occupational therapy, and to treat a caseload of 12 patients that would benefit from aquatic occupational therapy and therefore prepare them to be transitioned to aquatic occupational therapy once the COVID-19 pandemic allowed safety precautions to be in place and a safe return to aquatic interventions. As mentioned previously, I also spent time during my capstone at Ohio State University with Dr. Kemp. The Ohio State University is one of the largest universities in the United States and ranks as one of the nation's top universities, specifically as a top research center, with their presence known throughout Ohio and the United States. The role I played during this portion of my capstone was to develop a case study manuscript about the effects of an aquatic occupational therapy session of intervention to increase swim skills for children with autism spectrum disorder. This project was completed based off of a previous research study that I assisted Dr. Kemp with completing. While at Nationwide Children's Hospital, in order to increase the utilization and efficacy of the aquatic occupational therapy services, I needed to interview stakeholders to better understand their perspective on what the current barriers and strengths of the program were, as well as to understand various outcome measures. I was able to interview various individuals, such as the clinical manager of outpatient occupational therapy, the past aquatic occupational therapist, the current aquatic occupational therapist, the past aquatic physical therapist, and multiple of the current outpatient occupational therapists at NCH. In order to interview these individuals, I really had to focus my questions on the specific outcomes that I was looking to answer. This included acceptability, adoptability, appropriateness, and feasibility of creating a program, and the various structures necessary to increase utilization and efficacy of aquatic occupational therapy services at their hospital. For these interviews, I was able to gather a wealth of knowledge, including the specific barriers that were present and the current utilization of aquatic occupational therapy services. From this, I was also able to gather strategies to overcome these barriers. I then worked the rest of the semester from these strategies and adding additional strategies and creation of documents that were necessary to support the aquatic occupational therapy program, not only for patients with musculoskeletal conditions, but also those with non-musculoskeletal conditions and a variety of diagnoses and deficits. One of the first barriers that was identified was staff acceptability concerning the distinct value of aquatic occupational therapy services. To overcome this barrier, the strategy was to create staff frequently asked question sheets about aquatic occupational therapy, as well as a staff learning module that can be shared on SharePoint, where NCH keeps many of their documents. This would this would allow the therapist to have access both initially as they look at their current caseload and as well as they continue to gain additional evaluations and are able to consider patients in the future for aquatic occupational therapy services. Within this module and also accessible separately would be an algorithm to guide the referral decision-making process with guided images in order to increase the appropriate referrals that are created. The next barrier that was found was parent knowledge and acceptability of aquatic occupational therapy services versus those of aquatic physical therapy. To negate this barrier, parent fact sheets about aquatic occupational therapy would be created, as well as recommendations made to Nationwide Children's Hospital for their website to really reflect the services that are provided at their facility. Another identified barrier was the feasibility of communication between the aquatic occupational therapist and the land-based therapist. To work on this, a structured dynamic of communication with specific timelines and templates would need to be created in order to guide the aquatic and land-based therapist. The last major barrier that was identified was the feasibility of carrying out aquatic occupational therapy interventions with the current available knowledge and research of, or the current available knowledge of interventions session activities, as well as the current available equipment. In order to work through this, intervention plans and research and recommendation of equipment were created. The intervention plans would need to be general to address patients with all different diagnoses presenting with various different deficits. As I learned of the various barriers, I began to work on the actual documents and structures that would be put into place. Since returning to the aquatic environment at this time was not deemed safe by NCH due to the COVID-19 pandemic, my projects then took a turn to create the documents and structures that could be implemented for a smooth reintroduction of aquatic occupational therapy once safety could be guaranteed and the intervention was started again. Initially, I started this by completing broad literature review for aquatic therapeutic interventions to provide evidence as to the benefits of aquatic occupational therapy for a variety of diagnoses, including musculoskeletal and non-musculoskeletal conditions. Also, I searched and contacted various hospital programs with aquatics programs to learn more about how they structured their programs and what was working for them. As for NCH's own program, I took a look at the demographics of past participants in order to gain insight into the equity of their current aquatic occupational therapy program. This was able to aid me in making better decisions and recommendations as the projects moved on. I then created an algorithm to guide outpatient occupational therapists in making appropriate aquatic OT referrals, as they mentioned in their survey that they felt they needed more direction on this. This allows for a referral to come from patients with a variety of diagnoses, as various deficits are included in the algorithm to give examples of what could be addressed during aquatic occupational therapy. This has been provided on NCH SharePoint for easy access for the staff as well. Also on SharePoint is a learning module for staff that will be rolled out as a date is set for aquatic occupational therapy to be restarted. This included information about the benefits of aquatic OT, the referral process, the potential goals that the patients could be working towards, and case studies to assist them in understanding the aquatic occupational therapy service with real-world examples. Also on SharePoint are the staff frequently asked questions sheet that I created for the quick reference for the occupational therapist, as well as a parent information sheet and a what to expect during your first aquatic session information sheet for parents and patients. Then considering the actual implementation of aquatic occupational therapy services for a variety of patients, I gathered various outcome measures through the literature assessing many different factors. These were compiled into a list based off of the deficits addressed so that the aquatic occupational therapist can easily choose an outcome measure to assess progress throughout the aquatic intervention stint. Next, as the communication structure was a topic of concern when speaking with the past aquatic occupational therapist, I created a structured communication to be utilized by the aquatic OT and the land-based OT. This includes a template for the aquatic OT to hand over care at the end of the stint of aquatics. This information was also included in the staff learning module. Again, to best prepare for the return to aquatics, I worked on aquatic treatment plans with grading ideas listed in order to support a variety of diagnoses in the water. I created a general template for treatment plans to be applied for a patient with a variety of deficits, as well as 12 individual specific treatment plans to be implemented with the caseload of patients that I saw during my experience. Additionally, I created an easy token board to be laminated and used in the pool exclusively to support patients that need additional behavior supports. Also, for easy access, I created home exercise programs based on deficits that can be addressed in the water and offered ideas for carryover at home, whether the patient's family had a pool at home or not. This included recommendations to incorporate practice into daily life, as well as by utilizing a bathtub or a community pool. A list of exercises were also pulled from MedBridge and gathered by deficit for easy access by the aquatic occupational therapist when looking to provide a home program to the patients while they're at the pool. Lastly, I developed a list of useful equipment and where to purchase in order to be able to provide the best possible services to the client. Here you can see a list of just a few of the references that I utilized to create my systematic review and utilized throughout my capstone experience. While there are many more references utilized, these were important for the information that I shared with you in this poster. This experience aided me in growing my own skills, and I thank Dr. Kemp and Emily White for their continued support throughout the process. Thank you so much for taking the time to learn more about my experiences, learning about and understanding the effects of aquatic occupational therapy services for patients with a variety of diagnoses.